You know what the most tasty yogurt is? Is Lactobacillus crispatus. This vaginal microbe of all crazy things. Very interesting, Jesse. So Lactobacillus crispatus, the science in the last few years has been hugely clarified. If a woman lacks crispatus, because like rotari and other lactobacillus species, it's very susceptible to common antibiotics. So if a woman took, say, amoxicillin for an upper respiratory infection 10 years ago, she lost rotari and her crispatus more than likely. Well, a woman who lacks crispatus is much more prone to miscarriage, so losing a baby, more likely to have premature labor, which can be catastrophic. You know, if a woman delivers a child at 28 weeks, that child's going to have problem for a lifetime. Immune, neurological, psychological impairments. So lack of crispatus, more likely to have premature labor, premature delivery of a child. In the menopausal years, a woman who lacks crispatus is more likely to have vaginal dryness, pain, irritation, discharge, more likely to have pain with penetration, more likely to have repeated urinary tract infections, which is a big problem for ladies, and incontinence. Cough, sneeze, wet yourself. Very socially crippling. And by the way, the conventional healthcare solutions for these issues are terrible. They're terrible. A woman has to often make decisions like, should I take estrogens and risk endometrial cancer and blood clots, thromboembolic disease? So I believe restoring crispatus is such an easy, simple way to reduce risk for all those things. It restores vaginal moisture. It reduces cervical inflammation, because it's cervical inflammation that caused the cervix to prematurely relax and deliver a child prematurely, for instance. So crispatus, instrumental, critical for a woman's vaginal and urinary health. And we're seeing a lot of this data came from Loyola, which is about 10 miles from my house where I'm sitting right now. They have very elegant work showing that crispatus reduces risk of urinary tract infections dramatically and even reduces incontinence. And what's even more amazing is the bladder that we thought was supposed to be sterile has a microbiome. And among the creatures that should be there is crispatus. And even more remarkably, Jesse, a woman can take crispatus orally and it will colonize the vagina. How? There's no connection that we know about. And then it colonizes the bladder. So it's probably by contiguity, that is nearness, because that's an area that microbes are always, and that's another thing. Microbes don't stay in one place. They move around. That's good and it's bad. So for instance, one bad example is the oral microbe, Fusobacterium nucleatum, which overproliferates if you have bleeding gums or gingivitis or periodontitis, very common. And that microbe will enter the bloodstream and then colonize your colon, where the evidence is good, is very solid. It's a major driver of colon cancer. So think about that, Jesse. Colon cancer begins in the mouth. So the gastroenterologist is busy doing colonoscopies left and right, removing polyps, never thinking about neither the colonic microbiome nor the oral microbiome. You can see that to really understand a condition, say like colon cancer, you can't just look at the colon. You got to look at the entire body, including the mouth.
So you mentioned there the fact that crispatus taken orally makes its way to the vagina. Any other advantage in putting the bacteria right into the vagina or right into the colon from the other side? Or just going orally will be enough?
You know, tough questions, because no one's done these kinds of things. But I was talking to a research group who had a strain of E. coli that they thought prevented urinary tract infections. And they wanted to deliver this microbe by taking a big honking needle right through the abdominal wall into the bladder. And I said, why would you do that? It hurts like hell. You can miss. You can hit something, a vein or artery, and have the woman hemorrhage. You introduce injury and adhesions. I mean, a lot of reasons to not do it that way. And I said, it's your moral obligation to first prove this can't be done orally. They got mad at me. They said, no way, no way. I told them, we know that microbes, this is called translocation, can go from one location to another. How do you explain urinary tract infections with E. coli, a fecal microbe? Well, how did it get there? Fecal contamination. We know that microbes can migrate, whether you did it because you didn't wipe properly, or because it just did it because of surface contiguity in the perineum. Uh, it can migrate into your bladder. So we know that microbes can translocate. This is well established, but we can use it to our advantage with a microbe like Crispatus. Because wouldn't you rather have your wife or your daughter or whatever take something orally rather than having? Because once you introduce, say, a vaginal suppository, so a lot of these legs will have atrophy. It hurts. It's painful. You can typically cause bleeding. You also cause infection because when you insert things, you introduce microbes like Staphylococcus aureus and Streptococcus and fecal microbes. So the simple act of putting a suppository in a woman's vagina has risk associated. So we can do this by oral consumption. That is fantastic and spares a woman a lot of risk and discomfort.
Okay, that makes sense. And up until now, we're focusing on making this yogurt to enhance the counts. When it comes to Crispatus, are we making a yogurt for that? Or are capsules, probiotic capsules, enough?
So you're getting to an area, Jesse, where we don't have really solid answers yet, and that is the world of dose response. That is, so I remind everybody, microbes are not drugs. They're not metabolized by your liver. They're not cleared by the kidneys. They, to more or less, colonize the gastrointestinal tract and, in case of Crispatus, vagina and bladder. So they act differently, but we often don't know. Like the SIBO yogurt, we aim for super duper high counts to overcome the trillions of microbes invading your small intestine. In a lot of these instances, we just don't know what the necessary count is. So a typical Crispatus product will have about 10 billion, 5 to 10 billion. Is that enough? Don't know. So to illustrate, there's a study that came from, I believe, Korea, where they compared a strain of Lactobacillus gasseri, I believe was the BNR17 strain or the 2055, one of those two. And they gave participants placebo 0, 1 billion, or 10 billion. And their endpoint was waist circumference. So obviously placebo 1 billion, no effect. 10 billion, about 3+ centimeters of waist circumference reduction. No change in diet, no change in exercise, just get this microbe, 10 billion, and their waist shrunk by about 3.5 centimeters. And when they did CT scan or MRI and mapped out the cross-sectional area of fat in the abdomen, about 21 square centimeters. So significant just from this microbe. Now, if 10 billion worked, what would 50 billion have done? What would 100 billion do? What would more than that, trillion do? One of the things, when you do dose response studies, it's very expensive. Pharma has the resources to do that, but a lot of us don't have those resources. So let's say your study cost you $150,000, which to pharma is a rounding error. It's nothing. To us, it's a lot of money. So, but we added, let's say, 3 more dose possibilities, 10 billion, 50 billion. Now your cost is more like 500,000. So it multiplies the cost of your studies hugely. So most of us don't have that. So we're to a large degree, Jesse, we're in the dark. But that's why the yogurts are this cheap, easy, safe way to amplify counts dramatically. So in the original Rotary recipe, we started with 200 million, which sounds like a lot, but in microbes, it's nothing. It was a dose made for infants. We take 200 million, 36 hours, 12 doublings, we get 300 billion. So you get this huge increase in numbers. But I don't really know how many are really necessary. If you said, hey, I want more muscle from Rotary, or I want smoother skin from Rotary, or I want to see my testosterone go up, or I want my wife to have better vaginal sensation and moisture. What's the dose required? We don't know. But it's probably, this gauging by experience and thousands of people, it's probably in the 40, 50 to 100 billion range per day. Probably. As time goes on, we will get smarter As our evidence, other people's evidence accumulates, we'll know better. And it may be different for different microbes and different indications, but it's in the tens of billions. And that's one of my criticisms of the commercial probiotic world, is a lot of the probiotics have what I would regard as trivial quantities of microbes, particularly these probiotics that have multiple species. So if somebody says, well, we have 50 species, well, yeah, but they're such low numbers, does it really have any meaningful effect? So it's an area we have to work on.
Can we use the template we went over there for the SIBO yogurt for other human microbes, like Crispatus? I believe that's a human microbe. Other ones in that category, can we use our Luvelli and the system we've been talking about to enhance the counts? And then to explain what I'm getting into here a little further, talk about the difference between fermenting human microbes versus microbes that are on plants.
In general, to make life simple, Jesse, most, not all, but most lactobacillus species, Lactobacillus rhodori, Lactobacillus gasseri, Lactobacillus crispatus, and others, most do best at human body temperature. In other words, they're adapted to life in mammals. Your dog, deer, raccoons, and you. So they like human body temperature, which is the same in most mammals, right? There are some exceptions, but by the vast majority like human. So that means Lactobacillus crispatus, same thing. Human body temperature, 36 hours. And by the way, it's the tastiest yogurt you ever had. I secretly call it vagina yogurt because it was sourced from the vagina. Some people objected. I'm sorry, but it's a vaginal microbe. And by the way, very preliminary evidence to suggest Lactobacillus crispatus may be very important for prostate health. You know, prostate, Jesse, is something I haven't talked about much because there was so little we could do. There's stupid things out there like saw palmetto or finasteride. Yeah, okay. But I'm talking about doing natural things to set wrong things right. And it's become clear that men with prostate disease, one, almost all have SIBO, which surprised me. A study showed that men with prostate disease, whether it's prostatitis, benign prostatic hypertrophy, BPH, or prostate cancer, virtually all have SIBO, which is odd because, you know, if you had your prostate examined, the doc puts his finger in your rectum, it's right there. It's right there. So I would have predicted it's the rectal microbiome that was the dominant factor. It is a factor. So it was a surprise that small intestinal overgrowth was a major factor in prostate disease. So it must be by way of bloodstream endotoxemia. But even more remarkably, if you and I were to biopsy prostate glands that were diseased, prostatitis, bacterial or non-bacterial, BPH, prostate cancer, none of those men have Lactobacillus crispatus. If we were to biopsy normal prostates, they all have crispatus. Now, that doesn't prove that crispatus caused prostate disease, but it's starting to look that way, right? So men with prostate disease, until we know better, means address your SIBO, restore crispatus, and address the rectal microbiome, meaning the colonic microbiome. And we do things like the fermented foods, rhodori, gasseri, all the things we do for SIBO, fibers, prebiotic fibers. In other words, recultivate a healthy microbiome. In other words, so even prostate, like colonic health starts in the mouth, likewise, prostate health begins in other parts of the body. Interestingly, I call the prostate, I'm getting off topic, forgive me, but I call the prostate the grand central station of the microbiome. Because if we were to biopsy a diseased prostate, prostatitis, BPH, etc., you'll find oral microbes, Fusobacterium, Porphyromonas gingivalis. You'll find skin microbes like Cutibacterium. You're going to find gastrointestinal microbes, of course. You're going to find, in other words, you find microbes from all over the body in this little prostate gland. Now, are they causal or are they just benign accompaniment? No one knows. Kind of very tough to prove. But it's looking like prostate disease doesn't start in the prostate. It starts in other places.
Interesting. any area of the body sterile? You've talked about so many different areas now, including the prostate. Do we know of any area where microbes are not habitating?
But so far, everything that's been studied has yielded microbes. Like the brain. It was thought for years, forever, that the brain was sterile. It's not sterile. It's filled with very worrisome oral microbes, especially people who have dementia, Parkinson's disease, Lou Gehrig's disease, etc., diseased brains. But even in people without diseased brains have oral microbes, like those two in the prostate, Fusobacterium, Porphyromonas. It has the diseased brains are filled with fungal species, Candida species, and others. Now, what's not clear is whether they play a causal role in those diseases. So, if we know, by the way, with good evidence, a lot of this work was done in Spain, that diseased brains in people with dementia filled with fungal species. Does that mean we should eradicate fungi at their source? Maybe oral, maybe gastrointestinal, because there's a lot of fungal overgrowth in the gastrointestinal tract as well. No one has done that study, so we don't know. But it opens a question: does prevention of dementia, once again, start with eradication or reducing populations of microbes like fungal species in the mouth and the gastrointestinal tract? Don't know. But you can see that even as something we thought that was sterile, like the brain. So unfortunately, some things have not been studied, like the thyroid or the thymus gland or the vitreous in the eyes. These had not yet been studied, but so far, every organ that's been studied seems to have a microbiome and a unique signature of a microbiome.
Coming back to our Crispatus, I was going to ask you about Crispatus for men. You mentioned the fact that it has an affinity for the prostate. That gets me thinking, zooming back, as a whole, how different is this for men versus women? Are there any specific microbes women want to make sure they're getting, or men, that the other doesn't have to worry about? Or is it all very similar?
A work in progress, Jesse. So one thing is clear, that in most locations, so let's say, for instance, you lost 500 species because you took antibiotics in the past. Thankfully, you don't have to try to restore all 500 species. It'd be impossible, right? And you can't get them anyway. If you want to get some species, you really can't buy it commercially, and you can't ferment it, so you can't replace all microbes. But thankfully, restoring what I would call keystone species, so in the vagina, Lactobacillus crispatus would be a keystone or foundational species. In the gastrointestinal tract, Lactobacillus rhodori, Lactobacillus gastriae, foundational species. Now supplemented by, thankfully, fermented foods, and all those species that are in fermented food but don't take up residence somehow cultivate keystone species. So if you said, well, I understand that Faecalibacterium prausnitzii, the most important producer of butyric acid, butyrate, in your gastrointestinal tract, and thereby leading to reduction in blood glucose, blood pressure, triglycerides, fatty liver, deeper sleep, extended REM periods of sleep. In other words, all these wonderful effects. But how do you get more Faecalibacterium? Because you can't buy it. You can't cultivate it because it dies upon exposure to air. Well, you do it by getting fermented foods and those fibers. So hyaluronic acid, for instance, inulin FOS, and other fibers are wonderful cultivators of that Faecalibacterium. So you don't have to get all the microbes you want, restoring the keystone microbes. But with the vagina, it's not clear how far you have to go. Crispatus, clear. You got to have it. Maybe Lactobacillus gastriae. And by the way, it's the vagina and skin, the two organs in the body that must be acidic for health. Most other parts of the body are either neutral or basic, non-acidic. Like the blood is 7.4 pH, slightly acidic. Neutral is 7, of course. The vagina really likes about 4.5. Skin, about 4.5. Quite acidic. The pH scale, of course, is logarithmic. So a pH of 4 is tenfold more acidic than a pH of 5. So the vagina loves acidity. Well, one of the reasons why crispatus is so important, and maybe gasseri, is they're producers of lactic acid, just like our yogurts, and bacteriocins. So they kill. So if a woman has E. coli invading her vagina, which is very common, E. coli vaginitis, having an acidic pH as promoted by crispatus tends to suppress E. coli and other invading fecal microbes. So, but it's not clear, Jesse, how far a woman has to go. Should she get gasseri? Another species, Lactobacillus jensenii, Lactobacillus NC, Adipobium, Gardnerella. We don't really know whether a woman should, but probably not. It's my prediction. I don't know this for a fact. It's my prediction. If a woman restores Lactobacillus crispatus, she's already taken a huge step towards a healthier vaginal and urinary microbiome. Lactobacillus gasseri, one of my favorite microbes. By the way, gasseri, real important for female health. It's been shown to reduce the phenomena of menstrual cycles. You know, menstrual cycles are misery for a lot of ladies, and gasseri reduces the intensity of cramps and bleeding. And for the menopausal years, it reduces what are called vasomotor symptoms, like hot flashes. So gasseri, very important for female reproductive health. How far does a woman have to go beyond that? Not clear.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
When you lose weight by cutting calories, your basal metabolic rate drops by about 25%. And for all practical purposes, it's permanent. Study after study has shown if you cut calories...